Hi, my name is Rebecca Bowers. I'm a registered nurse at Eastern Kentucky University in the Psychiatric Mental Health Nurse Practitioner Program. And the reason for this integrated review presentation is to see if physical activity can be a treatment for depression or to reduce the depression symptoms. And this will be done through mega-analysis in a quantitative and qualitative studies to see if physical therapy can safely be carried out in an office or home setting. Now, the World Health Organization says that depression affects 264 million people globally. And they also say that by 2030, depression is expected to be the disease with the highest burden everywhere. And depression not only affects the individual, but affects the family and community as well by loss of productivity, unemployment, bringing unsteady behavioral health issues in the family, in the community, in the home. And the Center for Disease and Prevention Control reports there are effective pharmacological and psychological treatments, one being physical therapy or physical activity. And then due to the millions of people that are affected with depression, antidepressants are normally the ones that are ordered for people who have depression. However, this is not always a safe intervention for all people, especially as they get older. And so there has been more evidence of cognitive behavioral therapy, such as physical therapy, that has a positive effect on decreasing depression symptoms. Now, the theoretical framework I chose is a Nolan Fender's health promotion model. And this is a middle range nursing theory. And it's based on individual behaviors and their inner desire to increase well being and in good health. So, the individuals who choose to utilize physical therapy or physical exercise into their intervention plan to manage depression is using the Nolan Fender's health promotion model. By their preconceived ideas of the benefits and the positive outcomes that they believe they will receive by reducing their depression symptoms with the physical activity. Now, this presentation will highlight 3 research studies that support the concept of physical activity as a treatment for depression. There's going to be a mega-analysis, a quantitative study, and a qualitative study. Now, the mega-analysis, this is a blinded group allocation. It's blinded outcome and intention to treat analysts to describe the validity of the individual studies. And they were 23 randomized controlled studies, 977 participants, 18 years and older. The data analyzed was comprehensive meta-analysis version 2, and the measurements were the Beck Depression Inventory, the Center for Epidemiologic Studies Depression Scale, and the Hamilton Rating Scale for Depression, and last SLL 90. And the results were they were moderate to significant effects, and the conclusion was that physical therapy could indeed be a standalone treatment for depression. However, they recommended that further studies look into what other forms of exercise, whether it could be light exercise, vigorous exercise, or moderate exercise that would be more beneficial or could be modified for that person. Now, the quantitative study, it was a single-blind, parallel, multi-centered, randomized controlled trial. And they used Chi2 testing, and the measurement was Mini International Neuropsychiatric Interview, Mini, and that was at baseline. And at postline, they used the Montgomery-Åsberg Depression Rating Scales. The findings were the effect sizes were almost identical across all the exercise groups. However, in the light exercise group, it showed the highest results. And so the conclusion was that exercise shows more effect at reducing depression symptoms compared to treatment as usual. And the recommendation was to incorporate exercise into a treatment plan to control the symptoms of depression. Now, the qualitative study, that was a study to see the participants' preconceived ideas of depression and whether or not they can be viable, and whether or not their ideas would allow them to have a positive outcome with this intervention. And there were 33 participants. It was auto-recorded, transcribes verbatim. The transcripts were analyzed and coded using Atlas TI. And the results were most participants viewed it, physical activity as positive, and that there were a lot of quotes that said that physical activity gave a sense of general well-being. It gave them more energy and gave them an elevated mood, a sense of purpose, and a distraction of negative thoughts. The recommendations was offering structured group-based physical activity programs would be beneficial. And this evidence, was physical exercise compared favorably to no intervention and usual care for depression. And all three studies said that exercise is comparable to psychotherapy and antidepressants. And then based on the feelings of the participants, the over well-being and improvement of their self-esteem, the activity could safely be carried out in any environment. And so this activity could be implemented as a standalone therapy as long as the healthcare provider and the patient discuss the exercise plan and the goals and expectations. And then exercise can be done in a group setting or individual setting, and that in adopting this physical plan, the patients can log in their time at home or in the office, and that this would benefit both the patients who like to self-isolate and the patients who like to socialize. So the setting could be done pretty much anywhere. It could be initiated in the hospital or office, and then it could be transitioned to a community-based setting or home to safely manage the depression. And physical activity could be done daily, weekly, monthly, and individuals can walk, exercise anywhere, and it doesn't have to be just in a gym or controlled setting. And all the exercises can be modified to take into account for any physical disabilities, or if the patient is unsure of themselves and what they're capable of. So this is all the evidence that I presented today, and I believe that physical therapy can safely be implemented into a plan of care for depressed patients to decrease the symptoms of depression. Thank you. My name is Rebecca Bowers. If you have any questions, please email me at fortbeckbeck@gmail.com. Thank you.